Minute. Hi everyone, welcome to another Davis lecture. We're going to start in a minute once more people enter the room. Thank you. Okay, I think we're going to get started and let more people join as we begin. Welcome to another Davis lecture. We're glad to have you here this autumn 2020 season. As you know, CHAZ champions innovative and evolving tech to try and make health research and services policy research available to as many people as possible. In a moment, I'm going to hand the microphone over to SSA Director and CHAZ Director and SSA Professor Jean Marsh to give a brief introduction of today's speaker, Associate Dean for Academic Affairs and UC Berkeley Professor Susan Stone. The chat feature will be disabled for the webinar. However, if you have questions throughout the presentation, feel free to add them to the Q&A box. We will field those questions as best as possible following the presentation. Today's session is being recorded and will be available on the CHAZ YouTube channel post-lecture, and the lecture slides will be available on the CHAZ website. And now Jean Marsh will provide a brief introduction. Take it away, Jean.
Good afternoon, everyone, and welcome to the Michael Davis e-lecture series for fall 2020. I'm really delighted today to have the opportunity to introduce our speaker, Susan Stone, who is the Hutto Chair for Social Services in Public Education at the School of Social Welfare at University of California, Berkeley. Susan, it could be considered a University of Chicago lifer. I don't think she was born at Chicago Lying-in Hospital, but she received her BA, her MA, and her PhD from the University of Chicago. Her PhD is from the School of Social Service Administration, and we're especially happy to welcome her this year as we celebrate the centennial, the 100th birthday of the doctoral program at the School of Social Service Administration. Susan has many honors and awards, including being a fellow of the American Academy of Social Work and Social Welfare, being an inaugural fellow of the Society for Social Work and Research. She has many long contributions in the area of social work and education. And today we're really pleased to hear about her work in a research practice partnership on chronic absenteeism, school improvement, and systems of care. Thank you, Susan.
Thank you. I am just so delighted to come back home, although it's virtually, to SSA. I'm actually very excited to talk about some of my recent work in this area. So before I started, I wanted to give two kind of acknowledgements and talk a little bit about our partnership. And I wanted to first just acknowledge the support of three deans at Berkeley: Linda Burton, who is our dean at the School of Social Welfare; Prudence Carter in the Graduate School of Education; and Michael Liu from the School of Public Health, who really embraced our efforts to really develop and try to sustain a long-term collaboration with San Francisco Unified School Districts. I also want to be thank the William T. Grant Foundation for supporting this effort, which is part of their institutional challenge grant series, which in addition to digging into issues that are facing agencies writ large, to also to dig into some issues in community-based agencies. In our case, it is a school district, but also really think about ways that partnered work can be advanced and supported from the higher education side as well as from the community partner side. And I wanted to just talk a little bit about why we believed that we might be able to initiate this partnership. And I just do want to acknowledge that we have quite a bit of deaconal support. And I would say beyond the deaconal support across these schools, all of our schools have at their heart, they train practitioners, whether they're teachers, whether they're public health practitioners, whether they're social workers. And in addition to that, have aspirations for sustained and what Linda, our dean, would call really inching towards truly reciprocal work with communities. Moreover, these three deans really wish to model diverse knowledge generation strategies. So really embracing the multiple ways we gather and value and use different sources of evidence. I will also say that this partnership, we didn't enter it cold. My key partner on this project on the University of California side is Emily Ozer. Both she and I have had long-standing, more investigator-driven relationships with San Francisco Unified, which really we are really beginning to appreciate how much that set the foundation for us to build on, I don't know, a long years of building up trust and credibility with the district. I would also say that our partnership in many ways differs from other partnerships in that it aspires to really leverage multidisciplinary networks of faculty and students. They're bound by the emphasis on focusing on youth at Berkeley, and they span many schools within Berkeley. We are also, Emily Ozer and I are also on steering committees of other partnered work that is happening at Berkeley with other local school districts. So we are also hoping to bridge, have networks of research practice partnerships as well. And what is in the back of our minds is having an eye towards what are issues that Berkeley might have to change to truly engage in such a community engaged endeavor, knowing that community engaged can have very, very different meanings, in addition to a jointly constructed research agenda with the partner. So I'm happy to talk more about this. I think there's elements of this project that we are certainly learning about what we thought were our assets, what we took for granted in doing this work. So that could be a strand that we discuss as we get this up. So we have basically just started this work as of post-COVID, as of May. But we actually have been working together for at least a year, just thinking through how to construct a research agenda together. So just to know, I want to acknowledge our core team. Emily, the PI of the project, I serve as co-PI. I'm the fellow, which means I'm engaged with the institutional work. Or on the Berkeley side, we have really awesome a student partner, Brian Villa, and Marika Schottland is our wonderful administrative and support extraordinaire. We also, from the district, Norma Ming is our key partner, or our key liaison from the San Francisco side, in collaboration with Devin Corrigan. And we're not showing the depths of this, but Norma and Devin are doing their darndest to wrangle lots of the district stakeholders. So they're leveraging entire divisions within the San Francisco Unified School District. We're reaching out to principals. We're reaching out to various parent groups, special education division, and some of the peer resources, which are kind of the student-led activities in the district. And on our side, we have tried to bring together a network not only of deans, but our own vice chancellor of research, as well as at least 10 other faculty members that we intend that shape and consult with us on the direction of the project. So our what I'm going to talk to, our focus is on really squarely on school attendance and absenteeism. And I'd like to talk to you in the context of this partnership, why I see school attendance and absenteeism as particularly generative and particularly amenable to such a partnered effort. So I can identify at least four, and I think first and foremost is that issues of student attendance and absenteeism actually touch on the enduring educational policy issues that have been grappled with throughout historically. And if you think about it, attendance and absenteeism really point us to access to schooling, to point us to opportunities to learn. They orient us to distributions and inequitable distributions of these access and opportunity issues, especially among historically underserved subgroups. Attendance, as many of you may be aware, are also they're very inextricably linked to school finance and funding issues. So yeah, all states, even though they do it in very different ways, school enrollments and attendance are linked to funding distribution at some level or another. And states and districts can do this differently, but it's a school finance issue very fundamentally. Attendance also reminds us about just the variability across states, across districts, and across schools as governance and policy implementation units. And so as many of our institutions are, there's a great deal of state, and often, especially in the cases of schools, a lot of local educational agency control. So unlike many other countries, we do not have a national necessarily system of education. And then I think the final issue that I would say is that attendance and absenteeism will get you to some of enduring valence points of the roles and purviews of schooling. Some of the narratives in the attendance literature, I will say fundamentally, raise questions about what are schools ultimately responsible for, what is within the purview of schools, how do schools interact with other child-serving systems writ large. And so it really asks us to take some of the fundamental questions about what is the purview of schools as an institution, and is that overreaching or underreaching? I will also say I came into the area of attendance a little bit backwards. I hadn't looked at the literature in a very long time. And I had always perceived it as I don't know what this really tells us. I don't know how, or surprised that we know very little about school attendance and absenteeism. That was my impression. I would say for me, this since 2016, actually, it's before 2016. In the last 20 years, I think attendance has become more of a focus, but I think it's been especially heightened since 2016. And I trace some of that explosion to some of the seminal work here that was done at the Consortium on Chicago School Research, particularly focused on high schools that really were implicating attendance, especially in the early years, especially in the 9th grade year, as a very, very potent indicator of graduation. I would also say that as standards-based reform has been evolving in general in the United States, I also think that flexibilities that have moved away from achievement as sole indicators that have now turned to absenteeism as an indicator by which we can think about how schools are functioning. And we could debate about whether that is better than achievement outcomes, but many states have been really thinking about attendance and measuring that as another salient indicator. Post ESSA, or Obama's most recent revision of No Child Left Behind. I also want to be very transparent that the district, San Francisco, has actually made very, very significant investments in attendance promotion and absentee reduction. And I would say that I've been very, very humbled in this partnership that their work reflects the very, very complexity of school districts, that within a school district, there are usually many, many different entities working on similar problems, not necessarily maybe from different angles. And San Francisco has also had a very long-term commitment to really partnering with many, many local community agencies, the Department of Public Health, in general, in support of students and families in the district. So the district is not only complex and doing a lot of things, but the district also leverages other partners as well. So I've been humbled about those kinds of networks and the implication of those networks for how we think about partnered work as well. So we're partnering with the district, but we're also, by virtue of that, partnering within the district in different ways and partnering directly or indirectly with other key stakeholders in the city and the community that are also working on similar aims. Despite these investments, the district has not really seen, at least in the last several years, real reductions in their rates of chronic absenteeism. And so they wanted to really struggle with why that was the case. And I think the final source of this leads us into some big questions about not only sources and qualities of evidence, but uses of evidence. And I'll talk a little bit about where I fit in around sources of evidence, as well as what are some of the other foci of this project. But long story short, I think we all got excited because we saw this partnership as potentially facilitating new and different ways of spanning. And I think that these spanning are often about strands of research literatures on school non-attendance writ large, which is actually, I would argue, pretty fragmented. And that also actually reflects another strand about whose voice. And another element of this project is around youth and youth as sources of evidence. They are really about spanning, and as I mentioned this before, how might we join and effectively utilize these districts and the district, and I wouldn't say use, how do we effectively join with all these partners? Because they give us different pieces of the puzzle. They also, attendance is going to get to some of these issues about common dilemmas, especially when we think of Black students, when we think of other student historically underserved subgroups as both very painful sites of suffering, but also having potentials for real transformation, as well as, spanning more grooved and non-grooved research routines in universities about what kinds of evidence are more or less meritorious, what do we mean when we talk about impact? What does it mean to pivot from, and this is certainly something I have had to really shut up about, is what are my investigator-driven ideas versus what truly are my partners? What does my partner want to solve? And, learning to just keep my mouth shut a little bit and listen to what their concerns are. And often without judgment about why they're asking that question. And I can talk about that later, but I think that's one of the humble pie pieces of this that are very, very different than certainly I was trained. I was trained, and I probably trained my students, quite frankly. So I'm happy to talk about those issues too. I also, it's so interesting that we focused on absenteeism, right, as COVID transpired, which also has taken us and taken the district in several different directions that we may want to think about. Wait, is attendance, did we just make a radical shift about the meaning of absenteeism and the meaning of what does it mean to participate in school. So, so these are some of the general areas that we are hoping to try to make sense of throughout this process. And some of them, as you can see in summary, some of it's about thinking about the literature, some of it's about thinking about the complexities of schools as districts and appreciating that. Some of this is possibilities for change in schooling and possibilities for change in the orientation of research routines in higher ed. I showed that, so I'm sorry, I think, okay. So here's the key issue. So San Francisco really for the last, since 2016-17 has noticed that the district is above state averages in their chronic absenteeism rates. What has been particularly of note to the district that may not necessarily be surprising to some of us from the social welfare angle, that some of the chronic absenteeism is really seems to be concentrated among children who are homeless, not surprising, among children who are identified by the child welfare system, among students receiving special education services, and in the district, particularly among students who are identified as African American. And to give you some context here, actually San Francisco is actually a modally Asian district. So it serves many subgroups of Asians, so most, as well as Latino students. Unlike, I would say, their average free and reduced lunch rate, unlike other districts, for example, like Chicago is maybe 55 to 65% the last time it was counted in general. So it's an interesting district. They have these persistent rates of chronic absenteeism that are at least roughly, it has been and has stayed at around 30%. So 30% of students in these subgroups are missing, and I should say this is missing more than 10% of the school year. As I was alluding to before, the district actually, among its many neat attributes, it regularly draws on and generates very various forms of evidence. But the district partners were asking themselves, to what extent did they actually use the evidence? And they were particularly concerned. They will collect information and have mechanisms to collect information from youth and families, but were concerned that they collected it, but never really applied it. And so wanted to think about developing research routines to better uptake youth and parent voice. And in this case, this really reflects a lot of the literature. I was surprised at how limited the youth and parent voice in this area of absenteeism there is. And so this also reflects, and this is, I want to allude to the work of my partner. This really reflects key distributions across youth voice and parent voice literatures. And they're like, yes, we get youth voice, but we usually use youth and youth and parents, maybe as informants. The extent to which we actually engage youth in evidence generation, less so. And then finally, whether it gets used by those who are making or implementing policies in the district, it is, at least from this district's perspective, and I would say that would reflect the larger literature, it's limited. So my role on this project, there are two general, I think, foci of the project. And I would say that I have been tasked with the conceptual use of research evidence in this project. And I'm stealing from the research practice partnership literature, that what I'm contributing, and this is based on going back to the literature and also looking back at older sources of administrative data, and what the district has collected already to make sense about what we think we know and we might not know in the research literature in general, and how that might align with the other sources the district has collected. And I will tell you, the district has done, with other partners, in fact, they have looked at, for example, absenteeism across classes, across schools. They've investigated teachers that seem to really promote attendance at the classroom level. They have also collected lots of information through surveys, through interviews, information from students and parents alike. So what my role on the project is to just be introducing, whether these be new ideas. We're helping to frame the lenses that have been applied to this area, and think about how they might fit or not fit, or reveal opportunities for data collection. And just my role has predominantly been, at this point, as we've just started to really look within the attendance literature writ large, and to start to sink into administrative data sources that the district has on students, and also that the district has been collecting on the types of interventions that they, the services that are provided to students. So I will, interesting enough, like one of our first steps is the district based, one of their first and foremost questions was, are we actually in alignment with the evidence base? And I appreciate them. They were like, well, maybe all the stuff we're doing is, maybe we're not doing it. Maybe we're not, we thought we were aligned to the evidence base, but are we really? And that led me to really take a look at this literature and try to suss out what we have and take stock of what we have and what we don't have. And so I think there is one conclusion that we can easily make, is that there's a great deal of evidence that attendance or absenteeism, no matter how you cut it, relates to all sorts of academic outcomes, as well as other well-being outcomes in the short and long term for for students. So it seems to be a sentinel indicator. I think there is hope that it might be malleable, that it's possible that we could make attendance better. Would that then help down the road? I think we also know that no matter how you define attendance, and there's lots of ways we can define attendance, or absenteeism. We can do it dimensionally by looking at, days absent over particular time periods. We could look at it through tardies. We could look at class period absences, as well as kind of categorical indicators. And so I think some examples of categorical indicators are, have you missed more than 10% of your school days? Do you have unexcused absences? So I'm just giving you a landscape of the various ways in which we might conceptualize attendance or absenteeism. And I think a line in the literature would be that that maybe that is not the best way to go about it, but to try to think about this broadly as forms of non-attendance at schools. I think the other interesting piece of this is that we know that absenteeism is multi-determined, and I'm giving you estimates of effect sizes from a recent meta-analysis that are looking at factors that are linked to attendance. And you can see, I think many of you would be perhaps familiar with these, but some of these have to do with student physical and mental health issues, use of substances, lack of pro-social attitudes and skills, parenting support and involvement, family poverty and histories of maltreatment, school attachment, and school quality and climate. And if you look at this as I'm looking at, there's not that, we're getting fairly good signal in similar ranges across all of these multiple potential influences. I think we also know that that clearly there's structuring of attendance problems or attendance issues. So in general, attendance issues are actually fairly widespread. It's actually quite common that districts have critical densities of students that are absent for one reason or other, and that meet thresholds at a variety of levels. I think we know that districts and schools serving higher densities of students who are receiving free and reduced lunch seem to have higher rates of absenteeism. And I think in aggregate, there's just a large proportion of variation in chronic absenteeism, happens across states, happens across districts, and occurs across schools within districts. So beyond those kind of indicators that maybe student, family, or kind of micro class or teacher levels, there's other forms of structuring of attendance problems. So we want to keep our mind on that too. I also want to say, given those pieces of the puzzle, I am humbled by how little we know about how those various factors may or may not combine in unique ways. So we know that attendance is potent. We know that many things could possibly predict absenteeism, but perhaps not at a very at a mechanistic level that we might feel motivated to intervene on. And so I can tell you, I would say that I could tell at least 4 attendance narratives that attendance is essentially a family-related problem, that families, that this is an issue about parental involvement in schooling. It's linked to parenting issues. So it's really about it. Attendance reflects parenting problems. I think there's also compelling narratives in this literature that attendance issues reflect mental health issues. I think there are narratives in this literature that would say that attendance are fundamental problems in how teachers and schools engage students. And I think there's also narratives that attendance and absenteeism issues reflect how we mobilize, that they affect basically under-resourcing of communities, that they reflect housing issues, they reflect work precarity issues. So, and I really, honestly, there's evidence that I could tell most of those stories and have quite a bit of evidence to support any one of those accounts. And I would actually say, as you might have guessed, the attendance intervention literature, which is probably actually numerous sub-literatures, I find particularly underwhelming. And we could debate about what's a good effect size in that literature, but some of the explanations of where, how we got to this maybe unclear literature about what to do is Kearney and his colleagues, for example, would argue that this, you know what, this actually reflects that attendance interventions span many disciplinary perspectives, and that's why you'll get different takes on the attendance, or basic. I wouldn't say it's a different take on the attendance problem. They're looking at intervention from different levers. So there's kind of the psychology literature. There's a prevention science literature. There's a criminological literature on student truancy. And I would say that to give you an example of this, there's many of the intervention studies have typically focused on students with unexcused absences. And again, that tends to have a criminological focus. On the other hand, there's this psychological literature that has really looked at school refusal as in thinking about refusing school. Parents want a child to come to school, but a child is refusing school, and they typically trace this to issues around anxiety. So those are kind of some of the pieces of this literature. I would, and what we see, even though there are calls for, well, we need to think about arraying attendance intervention in multi-tiered systems of intervention in schools. And for those of you who don't know that language, it's like, well, what should we do overall as a school to just promote attendance and generally try to prevent absenteeism, for example. Then you have, well, once a child has, or a youth has gotten to a particular threshold, what is, before they go too far, if they're starting to exhibit patterns of non-attendance, what should we intervene? How should we intervene there? Those are typically called tier 2 interventions. And then finally, among kids who might really start accumulating really chronic forms of absenteeism, what are the array of interventions that might be suitable there? So knowing this happens, I would say that the attendance intervention literature is probably doing like a million of these things one time. It's not very well differentiated by its aims. But on average, that we can, many of these interventions say are associated with an effect size of gaining maybe 5 days of school. For many students, that would not necessarily be potent enough to arrest a chronic absenteeism. And the conclusion is, well, maybe there's no single best approach. And I just wanted to, again, articulate some different exemplars of some of the intervention strategies you might be familiar with or may have seen out there. And so Feller and his colleagues have looked at basically nudging parents, letting parents know through a variety of signals that, hey, did you know your child was absent? Informing parents and letting them know that attendance matters, very basic. And so those have been subject to a randomized trial, and it does look that those kinds of intervention that are typically targeted to students who are probably at lower, maybe around 3 on average, 3 days on average to the student body, those will gain about 1/3 of a day of attendance, as well as I think some of the more other intervention literature that has tended to focus on students who have greater densities or are into more persistent forms of absenteeism, or I guess that you would argue are getting into more chronic forms of absenteeism, will receive more mentored support. And again, those also show gains on attendance. They don't necessarily translate to other outcome domains as predicted. They're good at improving attendance. And as you can imagine, a lot of the discussion in the literature has been how costly is this? And so some of the more intensive interventions on average are about $1,500 per student versus less than $10 for the reminders. So the question to me is this seems to be begging for some sort of putting together. We probably need more than one intervention targeted to whom. And so, yeah, this is what I brought to the district. And so I guess we could say that we know attendance is important. We know that there are many issues that might influence attendance, but I'm not sure. And to quote Michael Gottfried, attendance intervention is far from straightforward. So that actually made, if we think about what the district was in fact doing, the district in fact actually did map this evidence base. They were using at tier 1 reminders to parents, really reinforcing the importance of attendance. But then when the district, started to think about, well, okay, what do more intensive pieces look like, and how should we sequence those? They were struggling and had various possible models about how and when and what kinds of extra supports to layer into students. So we worked together to try to think about what this meant for our work together. And I think based on what we learned from this literature is that we decided as a district that we actually might not actually understand very well the nuances in attendance. And so we are giving ourselves permission to really pivot from to move to more person-centered models about how students might accumulate absenteeism. And part of this is based on studies that have largely been conducted outside of the US and a little bit within the US that basically show that persistently absent students are actually a highly heterogeneous subgroup of students you'd be surprised at the variability among them, and actually students that are maybe not persistently absent, but that do experience some forms of absenteeism are also quite heterogeneous. But the point here is that some persistently absent students actually have characteristics that you might not necessarily predict should make them persistently absent. We also reflected a lot on sources of district-generated evidence from parents and students that really pointed to work and healthcare access precarities that often contributed to attendance, and that, quite frankly, that the district strategies really directly reflected gaps in the literature. So the district was aligned, but it had gaps precisely where the intervention and research literature had gaps. And so I would characterize these as as having two ilks. And one of them is a fundamentally question of our interventions. It's basically like, what is the attendance issue? Who is it targeted to? And what mechanisms is it targeting, and why would that help in that case? So wanting to do a little bit more thinking about targeting, and then really struggling with strategies that we're not fully, I think we have, that we're languaging to parents that attendance is important. And that we have a variety of strategies, that we have supports that we put students into to intervene, but we're not sure if those are actually the right more intensive supports, and when you would decide how students should get more intense supports. So in some ways, this motivated the district to, or where we are right now is we are kind of feeling motivated to look at different arrays of outliers of students in schools. And I'll give you an example of what that looks like when I summarize my next slide. We also then are also trying to really look back into administrative data to actually see to what extent and how prior services were targeted to students who were chronically absent. And the reasons that we are doing this, we're trying to find exceptional cases for cues about what the district might be doing that might be working better. And we are looking for clues about, do we have any ideas about how to sequencing the targeting of supports? And so in a nutshell, that's kind of our conceptual use of evidence side, that we've gone from the literature, we've looked back into district archives to frame how we're gonna look. And I'll give you a taste of what this first framing did. So what we did among elementary and middle school students in the district is that we took a look at students who would have been classified as chronically absent or not. And we arrayed them by whether or not they actually received a service. And we weren't surprised that because we know the district patterns of how they target services and around some of the chronic absentee rates, that we know that students who are identified as Black or who are identified in special education, writ large, were much more likely to receive a service. But we also took a look at what were characteristics of students who were chronically absent but did not receive services. And of the students who received services, was there evidence? What did we see among those groups as our first clue? So what we actually found is that district records of students who were chronically absent actually did not present with issues that were identified as attendance related. And in fact, if there's any signal in that, is that students who who received services and were chronically absent were differentiated by teacher reports of their behavior. So that's an interesting clue. And however, when we compared students who were chronically absent and not chronically absent among service users, they actually received the same type of services. And if anything, students who were chronically absent, we know that staff or support staff were more likely to meet about those students, but both received very light touch services. And oftentimes the services, there wasn't a big attendance signal in the chronically absentee students, and it did not appear that the services differentiated between students who were actually chronically absent and those who were not. So that's where we got to. And then, okay, COVID happened. And so I wanna just, so I'm gonna yank this back. I think we're gonna keep going down that road But in the meantime, the district actually rapidly pivoted to 5 different foci right away. As many districts in the United States had, they really turned their attention and their support infrastructure to 3 kinds of issues that are focused on access to technology, focused on reconnecting with families. I think some of you may have seen that, some estimates of up to 30 to 50% of families districts have lost and schools and districts have lost touch with. They focused on access to nutritious meals. At the same time, the district naturally broadened its definitions of attendance and to various forms of participation. So, did you log in? Did you make contact with the teacher? So they broadened definitions of attendance to various forms of participation. And finally, they removed attendance and participation as an actual performance indicator for kids. So there was that really rapid change, which I am going to argue, and I'm going to go back to my first slide, that focus us back on these sources of generativity, and also thinking about these various forms of spanning. So that sets in motion where we are. We have some clues about how we want to dig into the prior district-generated intervention literature. We have some clues about how we want to look at how we want to compare pre and post-COVID forms of attendance and participation. And I thought I would stop there, as it's been about an hour, to see if there are any thoughts.
Okay, Susan, thank you very much. Really fascinating set of ideas you presented here. I'm looking at the chat and so far no questions, but we have a very education and social work luminary audience, and many of whom are doctoral students. There's one whose dissertation committee you're part of, and so I hope we get some questions. Oh, here's our first question. David Ennis says, would some of these large data sets be amenable to machine learning statistical analysis?
So here's one of the, sometimes I think yes and no. My one worry about this is the administrative data are not, they're good for some things, they're not rich. I suppose you could possibly, if you think about what we might have on available from the administrative data sets, I don't know, the indicators aren't very nuanced. So we kind of know when you had your service, we know some of your demographic characteristics, we know some of your school performance characteristics. But this is a really good question, because we were like, could we actually, is there a way to profile this? And we worried we might be limited in what we can profile, but what I can tell you where I think this might come in is getting at patterns in attendance accumulation. If that, I think there's a lot of different ways students become absent. And we don't really understand that yet. There have been, I think, better attempts with survey data, but yeah, these administrative records are not as potentially rich around that.
Okay,
So
and
really pattern.
so we have a next question from Rick Barth. Hi, Rick. And the question is, are you at all inclined to think that MTSS could be the front end for figuring out which cluster types of non-attendance absenteeism a child and their family might belong to?
I do. I think that is I think that's very, very, very exciting. And I think that, I think there's some beautiful models from the Australians. And then one set of work by Michael Gottfried that has started to do exactly that. And so I do think that's where the cool profiling may come to play, but I don't know that we have many covariates to actually make sense of how those profiles might be different. But I think that should be, that would really enhance that first tier. And I think Rick is alluding to the fact, like, part of this first tier stuff in theory is really understanding your data. But if I'm interpreting what Rick has to say, is like, there's opportunities to do that in a much more nuanced way than we do right now.
Can I just interrupt for those of us who are the uninitiated? MTSS is?
Multi-tiered systems of support in schools. So in general, you know, for a particular domain about attendance, in theory, okay, this is the in theory, does it happen in practice? As a school social worker, I can say not so much. But in theory, you want to have a sufficient layer of preventative services or promotional services that have to do, typically in a school, that have to do with principals and teachers making all students feel like they belong in school, that we care if you attend, that we don't overlay robocalls on you, that there's this inviting, we care about you, and attendance is important, and parents, please know that we know, for example, that even though you might think an excused absence is okay, we really want your child at school, and we'll make a welcoming environment. The tier 2 stuff, this is where it gets a bit murky. From the evidence I see, and from what the district does, what typically we'll use teacher level interventions that basically, if a student is starting to miss, the teacher does outreach to parents, that you try to dig down into what might be the source of the attendance problem, and then how that gets differentiated from a more intensive, this is where I think it's murky in the literature. Some of it is mentored focused, some of it is family focused potentially. So in the attendance literature, I think that's murky. I think that there's probably a puzzle piece here that's related to how you define your attendance problem, which is advocated in general, but there is probably nuance to how we do that. And I guess the third piece of it, some of the clue is that there seems to be a subgroup of families where there's literally like there's work and financial precarity. That's a piece of that puzzle that's particularly characteristic of more occasional non-attenders. But I would also say that as an observer of school-based services, although there's a great deal of lip service to really trying to think meaningfully about the interventions or prevention strategies you populate your tiers with, that one of the tiers, schools will often do lots of indicated services and not enough prevention services. Sometimes you see schools do a lot of prevention, but not very much more intensive ranges of service. And I do think, San Francisco is, I do think it's populating its tiers, but I don't know that they've differentiated. I think they're at a loss to what should be in those more intensive tiers, what calls for more intensiveness versus not.
Okay. And now Bridget Davis, someone you know well, your colleague.
Bridget, I know this isn't Bridget and Susan time, but hi, Bridget.
And she asks, how are you thinking about or making sense of the lack of difference in the social provision utilization across difference?
You know what?
Pre-COVID, and then, are you ready?
Yep.
How do you think your hypotheses or insights about this seeming lack of alignment to the data might play out in terms of the efficacy of interventions employed during COVID-19?
So Bridget, that's a great, I actually had I actually changed my opinion on this quite a bit. I had some ideas going in, and I had kind of a glass, half full. No, I had a glass half empty. That's it. That you know what? Like this is a really bad sign. That your attendance interventions don't, oh my gosh, and I shouldn't reveal. I was like, this is just kind of these routine ways that we do practices in schools where this is reflecting, kind of non-specific things that we might do. And so I was very skeptical of that. I actually, now that I've been thinking about this, I do think that I think that I'm more sensitive to practitioners not knowing and having sufficient information. They'll have boxes like here's my school refusal toolkit. Here's my truancy kind of mentoring toolkit. That it does reflect that the district is reflecting the literature gap more so. I think the other thing that we might, that we actually might interpret that as is, maybe this is good that we don't see differentiated strategies, that that's a possible interpretation. But to get to your bigger question, what I've realized is that in this district, COVID literally disrupted their whole, I think it's potentially a really, really, really neat opportunity to rethink their services entirely. And I think what has happened is that it's making sure kids are connected to school. So I actually see that as positive, and these wider arrays of participation. We know districts are responding to this very differently. Some are being more punitive about what it means to participate. I've seen a lot of love for the kids and concern about the families. And what I've heard most from teachers and the service providers we've been working about is how much they miss the natural routine of just being able to check in with kids, that we could, being very worried about losing track, and doing much more pull-in than they would before. And as one of our district partners said, she basically said, you know, this is really a crazy time, but I hope we sit here in this disruption a little bit longer before we snap back, and think about the different opportunities this is offering us. And so COVID did initiate a very radical change to how families and students are how they're trying to pull families and students back to school.
Thank you. Nice observation. And Bridget says, nice point. The schools don't know because we don't know. And this is a very important point. COVID is an opportunity, and re-anchoring, acknowledging the role in school and in reality versus in measurement. Good point. And we have time for one last question from Harold Pollack. How could Medicaid dollars and Medicaid funded services be deployed more effectively to address attendance issues?
Oh, this is, Harold, this is the bane of my existence, school-based services. So, and I appreciate that this is a health policy audience. So what we know about how Medicaid has typically been taken up in schools has actually served to really center on individual interventions with students. And so those dollars tend to be used for more indicated services that don't always touch back to parents as much as we would hope. So if we could, I will tell you, we do know that chronic absenteeism does have lots of conditions on health for kids, and these span areas of anywhere from chronic conditions to asthma. And so I think one of these, I think linking this to health services more broadly, and then again, and I will say that as this has been deployed in schools, we typically think of Medicaid as supplementing mental health services. I think lots of, I should probably think more broadly about health, but the other side of it is opening up, broader interpretations of what tier 2 and tier 1 services are. And, you know, maybe I'm being naive. I think some of them, it does bring us back about who's delivering those services to. And some of it probably goes back to teachers versus service providers. So who's the right provider? Is that reimbursable? At least from my California context, it typically